I want to talk about courses without a doubt, because most of first aid and what you're going to do in the field makes no difference if you don't know what you're doing. So courses are, I mean, it's the stepping stone. And we'll sort of define that a little bit. We'll talk about first aid kits. I hope y'all hit me with tons of questions about that. I'll sort of break them down. And then a few things about on the water, right? Whether you're taking a trip, it's your local water, things to think about. And look, some of the shit's going to be common sense and you're going to roll your eyes, and I'm cool with that. That means you've thought about it. But I'm hoping that 1 out of 5 things I say helps for sure. Oh my gosh. So let's talk about courses. Are all first aid courses the same? What do y'all think?
No.
Right on. That's consensus. I see people nodding. I like it. They're not. Not even close, matter of fact. So let me just sort of define the difference between a traditional first aid class. And what I mean is you go to the local gym, an organization in down here in the States, which also in Canada, American Heart Association, that does first aid and CPR. Absolutely wonderful courses. They're awesome. But here's the deal. They are specifically designed with quick emergency services that are going to show up, right? So it is set up for you to take care of some quick life threats, have a heart attack, fix a few things, and then all of a sudden the medics and fire monkeys are going to show up. So it's kind of the quick stuff. Don't get me wrong, they do get into a little bit of first aid, and I'm cool with that. And it's a great course, right? But it is not designed for the stuff we usually do, which is emergency services is not going to be quick. So that's where the wilderness comes in. And I'm not going to get into the thousands of definitions that people have coined wilderness first aid or wilderness medicine, but it's pretty straightforward. Wilderness medicine goes beyond that. Again, not going to put a time limit on it. It just goes beyond quick emergency response or getting someone to definitive care. Everybody cool with that?
Yes.
Cool. So I'm going to define that a little bit more for naysayers. This doesn't mean you are in Squamish in the middle of nowhere throwing a spay rod 4 days from home. It doesn't mean the Seychelles. Think about it. Unless you're fishing in downtown Calgary, in downtown Denver, or in Asheville, North Carolina, in the middle of town, where something happens, you have cell service, you call 911, you freak out, you do your basic first aid, and the troops show up. When you just do a regular home water trip, even if it's a 30-minute drive to the trailhead and or parking lot, you walk 10 minutes to the river and you walk 10 minutes up the river. You're 45 minutes from when the ambulance even rolls, right? A lot of stuff can go down in 45 minutes. A lot of stuff goes down in 7 minutes, right? So wilderness medicine takes you beyond that 8 to 10 to 12 minutes before emergency services comes. The next thing it does that basic first aid classes don't do is what to do after that, right? So if you have to package a patient, hypothermia, hyperthermia, all the stuff that isn't covered in a one-day class at the local high school. Medical emergencies. Traditional classes talk about the common ones, right? Stroke, heart attack, that kind of stuff, how to recognize it, how to deal with it for 8 to 10 minutes. Wilderness first aid, wilderness medicine teaches you how to deal with it for an hour to 5 days, right? If you're in a remote location and some traumatic injury happens, if you have some kind of medical incident, what to do beyond initially assessing and checking it out. The third thing wilderness medicine teaches is critical thinking and recognizing a medical or traumatic emergency before it turns into a shit show. So the further you're away from definitive care, the better you have to be of saying, well, yeah, I'm going to use just a common example. Is this little chest discomfort because we had 4 hot dogs at the takeout and it's indigestion, or holy cow, do we need to be concerned and start thinking about our plan to get out of here? So it's great. That's the difference between a wilderness first aid course and a traditional first aid course. Everybody cool with that?
Yep, sounds good to me.
Somebody ask a question. I'm all excited. Okay, I'll move on.
What you wish for, because I'm going to start throwing them at you then.
Nice. So that's important for folks to know because everybody should take a course. And the next little thing on the bullet pointy thing is any course better than nothing? And common sense tell you absolutely it is, right? Unless it is just a total ridiculous course that doesn't teach you anything. And that goes with anything, whether it's fishing, whether it's math, I don't know. But any information is good. A traditional CPR and first aid course will teach you how to take care of a severe bleed, how to use a tourniquet, kind of how to manage the scene in 7 to 8 minutes, not for 4 days. So a good traditional course is better than nothing. But from what we all do, and I know you do it because you're on this podcast or whatever, a good wilderness course, 1 day, 2 day, 3 days, 6 weeks, I don't care, I think will blow your mind with the information that you walk away from with a course.
Tina had a question. I have a question. And I remember from the podcast, I had the same question. And that is, who should we, I know it's a loaded question, especially because some of us are in Canada, we've got America, Australia, but where would you recommend that the average person in North America find a course? Is there a website that you would suggest? I know that you don't recommend online courses.
Not a fan. Now that COVID's over and we have a choice, no. Online courses, no. I think you need to touch it, feel it, see it, be put in the situation to be able to react, especially to an emergency. So this is what I'll do. This is a little different. I know this is going to be thrown out there in the internet world, but I can recommend 5 organizations off the top of my head, either because we have taught for them, we have not really taken them, but we just know they're legitimate. And I'm going to throw this out, April, for folks who are wondering why this is such a tough question. The wilderness first aid sort of course curriculum is not regulated, right? So there's no state entity, there's no medical board that says, this is approved, they're doing the right thing. And that causes a problem because anybody can start Bill and Ted's great wilderness medicine school because they were in the Boy Scouts and they went hiking one day, right? But with that being said, both in North America and up in Canada, there are some amazing courses that crank out amazing classes. So I'm going to throw these out. I don't know if you put anything on the, where people can go back and look, but we'll throw some links if you do that up. Yeah.
Sure.
So Wilderness Medical Associates, WMA, awesome. We taught for them. They are international. They are in Canada. I've actually taught in Canada for them. So WMA is great. I'm sure you guys are familiar with Knowles. So Knowles has the Wilderness Medicine Institute. So WMI, part of Knowles, they're in Canada as well. Desert Mountain is another good one down here in North America. They're sort of in the Southwest. And then, of course, there's Fins West and Katabatic Mountain School, but we don't do open courses, unfortunately. But so there's the start, and there's a good start because once you Google that or start to look, others will pop up, right? And that brings me to this because I think, April, you asked this in the podcast. How do you know, right? If there's not a WMA, WMI, Desert Mountain, Crested Butte Outdoors, another incredible course. As a matter of fact, they taught us everything we know, Sue Purvis, and she teaches in Canada. But it's kind of the old fashioned way. Shoot me an email, look at reviews, kind of look at their course curriculum, see if it jives with the ones that I recommended. Because there's a bunch. And I wish that, there was some system that would be like, oh, they're great. But there are some that are absolutely horrible. So that's my recommendation. There's 3 or 4 I gave, I think.
No, that's great.
Shoot me an email.
Perfect. Any other questions on courses before we move on to the next part? I've got a question about this photo, Tayloe. Obviously, this is training. What is it, Bahamas?
No, you stood right there. That's El Pescador.
Where? Oh, in Belize. Okay, I gotcha. So are they now? They're doing a drill, and they've got this gentleman in a sling. Who has that? So does the lodge have that? Or are they supposed to have those in their boat?
They made it. So all that is the casting lean post with a tarp appropriately folded to get somebody out of a boat, and he's got a broken femur.
Got it. Okay. All right. So
there's another. That's a good point. That is another thing that the wilderness first aid courses teach. And look, and I don't want to spend too much time on this because there's tons of cool shit to talk about, but wilderness medicine is not making a splint out of bamboo, prongs and some rope. And it's not treating poison ivy with some mud out of the jungle, right? I mean, it's evidence-based medicine. But what it does is it teaches you the correct way to do, medicine in 2023 and adapt to where you are. So these guides, we showed them how to make a litter, what a normal rescue litter looked like. I gave them 20 minutes to look through their boat if they had to get somebody out quickly. And they came up with this. I didn't. They pulled the lean post out, pulled the tarp from the bench seat. We had talked about how to fold a tarp to keep people from slipping out. And my mind was blown. This has been a ways back. And I use it in every course now because I didn't even think about it. So that's another really cool thing with these courses.
Love it.
Cool. All right, yay. We could go down a big rabbit hole here. And I know we're only supposed to go till midnight. So, yeah, let's talk about first aid kits. And look, I will touch on things to go in a kit. We'll sort of talk about it versus me just rambling. But there are way more bullet points in thinking about kits than actually what goes in them. I hope this is a good, poignant moment, maybe. There you go. Without a shadow of a doubt, if you don't know how to use what is in your kit, then don't even carry it. It's pointless, right? So that's just how I lead off this presentation whenever I'm doing it, for sure. Something to remember and understand, and I know, hey, you said this, these 2 things that are kind of a bummer. Even the best kits made that you can buy off the shelf, and I don't know, 10 years ago, I wouldn't have said this to where I actually trust a first aid kit that you can, buy retail, but now there's some really good ones on the market. But they're not perfect off the shelves. Even the ones that we design and have through Conterra, they're not perfect, meaning any kit that you purchase and you're looking at, not building, because then you can make it perfect, is you need to go through it and match it to what you're doing, where you're going, what your training is. So just understand that one kit you yank off of, I don't know, what do y'all have up in Canada where you go into a store and buy something?
Mountain Equipment Co-op.
There you go. So MOC, that's great. It's not going to be perfect. You're going to need to take a bunch of fluff out. You're going to need to add some things that you've learned about. So just keep that in mind. There's not one perfect kit, regardless of what they say on the website, for sure. The next thing is, look, there's not one kit for every situation. I'm not saying you need to have 35 kits, but the kit that you take on your home water, where it's just you and a buddy, or it's a short duration trip, it's not going to be the same one you take to Mexico. It's not going to be the same one that you go in on the Dean. Look, I'm just saying cool things because I know that's up there in your part of the world, right? It's going to be different, and it's going to depend on a few things, which we'll talk about. But having a couple of choices, two choices, your travel kit, your close to home kit, it's just something you got to get your head around. And I see it time and time again. We'll be wherever, the Bahamas, Belize, Honduras, and I always check people's kits out. And it's the same kit they carry all over the planet. Now, you could change some things around in that one kit that you have. But again, we'll talk about how that doesn't work so much, right? Because it's either going to be too big for your home waters or too small if you go on an extended trip.
What's the number one thing that you find is missing in most store kits and or individual kits?
I think the basic stuff, to be honest with you, right? Because I think people they get the stop the bleed, tourniquet, that kind of stuff gets pounded into them, but just the normal wound cleaning, right? Wound cleaning's the worst. It is the number one thing we need to do is to clean a wound, right? To prevent infection, promote healing so your trip doesn't end 3 days later, but just supplies or the know-how how to actually get in and clean a wound simple so it doesn't turn into something bad. That's what I see. They got all the cool stuff, but not the stuff that you need.
So what would you use for that? Would you just carry a bottle of vodka that you can sip on conveniently, or would you have little would you have
Yeah,
hand sanitizer? Would you have little pads?
like
What's that?
betadine swabs.
Yeah. Do you say povidone iodine?
No, betadine swabs.
Betadine. Yeah, totally. So any
Just
kind of
carry that.
antiseptic, believe it or not, potable water is one of the best things in the world. But what you need to do is you need to deliver it correctly. So in other words, just pouring cups of water over a wound, you need high pressure. So you need a syringe with a small tip or a wound cleaning syringe that actually irrigates and cleans the wound. That's the big thing. But to answer your question, povidone iodine, any kind of antiseptic that you can dilute, so you can carry, like you said, a little. Where's my hand? A little 3-drop bottle will last 2 years to get in there and really disinfect and clean a wound for sure. But the delivery mechanism is the most important. Again, we're not getting into treatment modalities, but to give you an example, if you were right down to it, taking a Ziploc bag and poking a hole in it and squeezing the Ziploc bag sort of turns that high pressure thing. Now, granted, it's 2023. We should have a high pressure 20, 30, 40 cc syringe in our first aid kit, right? We shouldn't have to revert to a hole in a Ziploc bag. But that's some of the stuff you learn in a wilderness course where they show you the right way, and now you can improvise knowing the right way to do it, right?
Very interesting. Okay.
I'm just thinking my next trip to the doctor in the hospital, I'm going to get sticky fingers all the way through his office.
Sweet. And that's another thing we'll do, guys. I mean, we're not even down there yet, but and I hope April can put some links into this thing. But now the cool thing is you used to have to do that, right? You roll into the doctor's office, and when they go out for 4 hours before they come in, you have to load your pockets up with stuff. But now there are some stores or whatever you call it online that specifically tailor to this stuff that you traditionally can't get. Wound cleaning syringes, little small bottles of povidone iodine, tourniquets where you don't have to look through, Amazon for 6 hours to find. There's just a one-stop shop to build just massively cool first aid kits or effective first aid kits.
Awesome.
Cool. So we get this question a lot, and I wish somebody would ask it. Matter of fact, I put a sheep on here to ask this question, but I haven't heard him ask it, so I'm just going to go ahead and say it. What's better? Should you build one yourself or buy one? Right?
Yeah.
I'm going to do this. I'm going to turn the tables because I can see you all. Have you bought your kit or did you build it yourself?
Bought my kit.
Cool.
I don't have one.
Wait a minute. I can't see who that was. I don't have one. You need to get one, whoever that was.
I think Joe.
Probably old Slinky Andrew.
They
So
yeah, based on how many guys are in the group with us, and then what activity, whether it's backcountry skiing or adventure fishing, or yeah, surfing. We don't really carry one for surfing, so yeah.
oh, should have one in your backpack on the beach. Anyway, so look, 10 years ago, I would say absolutely build your own, go into the doctor's office when they're not in there, start raping the stuff out of the cabinet. But there are some great kits out there on the market now. So if you decide to build a kit yourself, right? I mean, you still need to look over the ones you buy, and we're going to talk about that. The big question is, do you have the knowledge and the expertise to actually build an effective kit? Does that make sense?
Mm-hmm.
I mean, it's kind of a lot of work to go online, find a list, listen to these things, that we're doing, and kind of put together and go find everything. It's easier to build a kit now. I mean, again, a couple of places, one-stop shop. You can pick whatever you want to include the bag itself. So I think the biggest take home is, do you have the knowledge and expertise and know where to get the stuff to build a kit? And if so, then do it, because then you know that kit inside and out. Buying a kit's fine as long as it has what you need, it's quality. And look, we spend thousands on fishing equipment, thousands. Don't skimp on your kit. If you buy a $12 first aid kit from Wally World, you're going to get a $12 first aid kit. Not something I want to rely on if I'm bleeding to death. And I don't mean that in a bad way, right? Cool. So, okay, here we go. Here's the take home for the kits. Not even talking about what's inside them. The construction of the kit, right? I'm going back to the $12 kit, right? The bag is going to be horrible. The zipper's going to blow. And when that happens, you now put it in a bag and tape it. Now something bad happens and you're now trying to rip the bag open. So just like our equipment, get a good container, right? I mean, if you're a raft guide, a skiff guide, a drift boat guide, or you own one, get a hard case, right? Get a Pelican case. Nanook is up there in y'all's world, I think. And build your kit out of something that's completely waterproof. You can throw it around, it's good. But the base bag needs to be good. Seams need to be good. Zipper needs to be YKK or better, brand, so it's going to stay intact. Everybody good with that?
Mm-hmm.
It seems like common sense, but we look at thousands a year, and the bag is, to me, one of the biggest things. Within the bag, it needs to be organized, right? It needs to be because you're not medical professionals. If you are, you wouldn't be on this thing, I don't think. But when the proverbial shit hits the fan, your stress level skyrockets, even professionals. The last thing you want to be dealing with is finding something to save somebody's life in the bottom of a dry bag. So if you open a kit and it has your modules, which we'll talk about, pockets, you can see, easy to grab, then stress level stays just at terrified instead of super terrified. And you can get to your equipment and treat the problem. It's not adding to the problem. Seen it a bunch. So good organized kit, which we're going to hit coming up. And then I've already talked about quality supplies, right? I mean, don't skimp, because this is medical. It's not, you're just trying to get by with whatever, for sure. Any questions on stuff even before we put stuff in it?
No, I'm curious.
Yeah, I got a question. I got a question for
Yay.
Tayloe.
Cool.
Hey, is there like equipment that has, like you come across that has multi-purposes? Like, so if I'm buying something, do I have to buy two of one thing, or can one thing serve a couple of different purposes?
Ooh, good question. And who's this, Mr.
This is
Dookie?
Chad.
Yeah, you need to
Yep.
turn your video on so I can see your old face after many years.
It's been a while.
Absolutely. And we're gonna hit that here coming up, but that's a great point. To keep the size of your kit down, have items that have multiple purposes, right? Does that make sense? So I'll give an example, and we're kind of ahead here, but I think it's cool because it's a great segue. Let's say that you could have a tourniquet that also could be used as a pressure bandage, that also could be used to, say, wrap a splint on a leg. There's three things that you could use for one thing. And ironically, something like the SWAT T. Just an example. I don't have anything to do with these people. They're a great device, but it's just that kind of thought. And like Chad was saying, that's the first thing that we always teach and think about is this device can be used for three different things, right? I don't know, over-the-counter medication, Benadryl. Now, again, I'm not going to talk about prescription meds in this thing, I don't think, but this is common knowledge. You buy it at Walgreens. Benadryl can be used for like 4 different common things. Great stuff, right? So antihistamine's one. It can be used for sunburn because you get sunburn, it's antihistamine. It can be used as a sleep aid on those long trips, long flights, right? I mean, it's stuff like this. And again, I'm not pushing a course, which is cool because you can't take one of ours because we do closed lodge courses. But this is the kind of stuff that is taught in a wilderness first aid course. Pretty cool stuff. Good question. Thanks. What is it, Mr. Duthie? Chad, is it snowing?
No, it's not snowing.
All right, good. 80. It was 80 here today. Just saying.
How the fire ants.
Yeah, whatever. Okay, cool.
Okay. Tayloe, you've got me all excited now. And you said SWAT T. I'm going to look that up. What was that thing you pulled up there?
Yeah, it's called the SWAT T.
What does it do?
It is a tourniquet first and foremost. It's a 4-inch elastic band that is made, and it's pretty cool. Again, can't get into it, but because it's a 4-inch elastic band, you could do, I mean, it's a dog leash at the very end of that list, right? So, yeah. So, Chris, I think what you were saying, you made a really good point about your activity. How many people, whether it's backcountry skiing, that's the last consideration before we start talking kind of about the kit itself is, first of all, your training. So we see this all the time, and it used to make me mad, but now I'm really old, so now I just laugh. Don't carry anything in your kit that you're not trained or you don't know how to use. Sutures is the biggest, and I'm going to get into that unless somebody asks the question. Just don't carry anything you're not trained to do and hope somebody there can do it because we'll let them carry it, right? Trip duration kind of goes to when we were talking about sort of not just having one kit. So trip duration, that home water, you go, you fish it a couple hours during the day, close to home, close to your car, good communications, cell phone service. You're going to carry a kit, but not a big one. Longer trip doesn't mean you carry more advanced stuff. It just means you carry more stuff, right? You're going to need 12 more Band-Aids. You're going to need another roll of tape. You're going to be able to, you don't have to clean a wound or two when you're wherever, in the Seychelles, in Mongolia, somewhere. You're just carrying a little bit more. And the fact that you're on this, well, it's supposed to be a Q&A, but on this gig, that means you're on it. Right? You care. You're probably the person somebody is going to come to because their kid is like this little orange one over here, the size of my wallet, and you're in Bolivia. You're going to be prepared. So you always throw a little bit more in there, right? And number of people goes along with the same thing. Everybody good with that?
Mm-hmm.
Mm-hmm. All right. Uh-oh. Oh no, I can't change my slide.
Touch the screen with your cursor and then try.
Oh yeah. And my technical support team is sitting 3 feet in front of me, not moving at all. All right, cool. Look, let's look at the anatomy of a first aid kit without getting just, and we can't go down the rabbit hole. I'll answer any questions you've got, but I'm just not going to go down a 4-hour presentation. The way you should envision buying when you buy or setting up your kit is in modules. And the modules specifically are for the injury or the category that you're going to cover. It's a great way to check your kit. It's a great way to organize it because you can grab and go. And these are sort of the basic ones, right? So your personal protection, oh, touch cursor. Look, it's still up there. So this is kind of how it's broken down. I couldn't get a cool picture behind this thing.
I'm going to screenshot this table. This is awesome.
Cool. I mean, I think there's some kind of there's a, what's the word, copyright sort of charge or something. Anyway, so first and foremost is your safety and treating other people. So personal protection, there should be a little mod with simple gloves. And other than just getting gooey, sticky stuff all over you, if you've got to treat somebody, it actually mentally helps you to dive in and do something. If you have a pair of medical gloves, right? It just is what it is. So always good, but really just so you don't, infect somebody else as well. Eye protection, we all have sunglasses. These are just sort of normal things. Sunglasses, your glasses. If not, throw a cheap pair of those little clear glasses in there just so you don't get splattered. Little Sani wipes, right? Like sanitation wipes to clean off any of the, again, this is for you. Clean off any gooey, sticky that gets on you. Sorry, I'm a medical person. I don't know how to word it any other way, right? And there you go. I mean, we could go deep into that on a kit on an ambulance, but this kit is not on an ambulance or heli, right? It's in your backpack. Next mod, the most important mod, period, is your life threats. And what I mean by that is this is the mod that takes care of stuff that could potentially kill you, right? Or not you, but the person that it happened to, or you, right? Pretty straightforward, right? We just need to take care of bleeding and breathing. That's it. I mean, and a basic CPR first aid class from American Heart takes care of this. I still recommend going beyond that. So a CPR shield, which is like a face mask, right? If you have to breathe for someone, these days you don't have to breathe for people when you learn CPR. It's kind of the lay people CPR. They just want you to push fast and push hard, right? And it works. But let's just say when you learn this stuff, there's some type of breathing problem and you have to assist. So always have something, because if you don't have it, you ain't going to do it. So a little face mask, CPR shield. To stop a bleed, severe or not, the best way to stop a bleed, period, is well-aimed direct pressure, right? Getting in there, doing it correctly, not going to teach that, but that entails a thin gauze pad going directly to the laceration and the bleed. So gauze pads for that, and then a tourniquet, right? Should be in every kit, period. Lifesaver, I don't care what avenue you're on, this has saved 1 million lives. And know how to use this device. It is simple, but the first time you use it, especially if it's me that's bleeding, is not the time to pull out that little 3x3 insert in a tourniquet, right? A couple of options out there for tourniquets from the Compact SWAT T. You would think that I had some invested interest in that, and I do not. To the windlass tourniquets that you put around and you turn the stick per se. They're the best, right? I mean, one application though. I mean, it's a tourniquet. Blood stopper. Everybody cool with blood stopper? So quick clot. So blood stopper is I don't want to say chemical. I just say it's a compound that is impregnated in a gauze bandage, and it helps I'm not going to say clot because it's not a medical class. It helps stop bleeding. And they're amazing. You used to could not get them unless you were medical, EMS, that kind of stuff. You can now order them offline. You can get them at Walmart. I saw some at, I don't know, our pharmacy, Walgreens here. You can buy packets of them. They're amazing, right? So if you're doing well, go ahead.
For the brand again, I'm just writing these down.
Well, there's several brands. It's just if you're gonna look, or anybody's gonna look, just Google blood stopper. It sounds crazy, but boom, and then you'll have Chita Sam Medical, Quick Clot. Those brands will come up. There's not many off brands that you need to worry about because it's regulated pretty heavy, right? Like there's not a Walmart version that I would say don't get. But it is not the end all, but it assists. You're doing well aim direct pressure. You have a not a life threat bleed, right? Just a normal laceration that can be controlled. I mean, this just throw it on and it helps. Cool. I've got chest seal. Chest seal is if you poke a hole in your chest, you have air going in and out. Again, this is totally you got to take a course and learn this, but it's one of the life threats that is easy to fix in the field if you have the appropriate knowledge. So an occlusive dressing for a chest seal. Any questions? That's the big one.
Scaring me.
Good. I try not to do that. I mean, when I do these things or I do a podcast, I get a thing and people say, man, you're using a scare tactic. No, I'm not. Look, I was a paramedic with, by the way, just shout out to Mr. Duthie. He was my partner on the ambulance in Colorado. We responded to the same rivers and water that we both guided on. And look, man, we've seen it. Stuff happens all the time. I mean, it's just, we just shrug because most could be avoided with a little bit of knowledge and schooling, right? I don't know about avoided, but they could have taken care of the situation a little bit better, right?
Yeah.
Okay, sorry, everybody's now bummed out. Boo, people get hurt. So look, another mod that's a good thing to have is for your sprains, strains, and fractures, your breaks. And all that entails is you got to stabilize it, right? So that is some type of splint. And I will say I do have vested interest in this company, but because they're the best. A SAM splint. It was the first, and it is still the industry leading packable, lightweight, moldable splint that fits in your first aid kit that you can do 137 things with, to include stabilizing a unstable sprain, strain, or fracture. You got to be able to wrap it and hold it on. So there needs to be some type of device for that, an ACE wrap, vet wrap, Coban, that kind of stuff. So that's another mod.
Tina is asking about the chest seal, and I know you don't want to go too far down this, but just generally, how is that done or used or applied?
Okay, we're kind of going down that rabbit hole by answering those 4 questions. But look, how come I can't hear Tina ask a question?
Tina's on chat.
Oh, you can. To my technical advisor, he asked if you could chat questions in.
Yes.
Cool.
But just what is it? I mean,
so fair question. So let's say I'm going to give you an example instead of try to go into a paramedic teaching class. You're walking along the river, you trip and you fall on a twig or stump that's sticking up and it goes into your chest cavity. You now have a hole there and where it's not supposed to be. And you can't just cover it completely because then air builds up in your chest. So it's an occlusive dressing that allows air to vent, but not to come in.
That's really cool. Okay.
I'm getting deep. I'm not supposed to go that deep. All right, look, my little thing is covering up what the next thing is. I know because there's... Do what? Oh, hang on. I'm going to do something techno. Oh, everybody went over there. All right, cool. So wound care. That's another mod. And again, I wasn't going to dive into each of these things, but it's just a mod that you need to think about having. And wound care is not life threats, right? It's not severe bleeding. It's not bad stuff. This is normal day to day. And that should be focused at a couple of things. One is stop any bleeding, right? Severe or not. And then clean, debride, and irrigate, right? So to get all the nastiness out so you can promote healing and protect against infection. That's it. That's the mantra. So to do that, if you look at the kind of the list, we've already sort of talked about it. You need to have some gauze pads to clean. You need to have a syringe or a wound cleaning syringe that has high pressure, water. When I say high pressure, I don't mean from, like a jet sprayer. I mean from a syringe that cleans it out, some povidone iodine or some type of antiseptic that cleans, that you can dilute. And then you need to bandage it and wrap it, which could be simple as a Band-Aid to now a gauze pad with some gauze wrap to keep it clean and dry and protected. And here's the thing about the wound thing, depending on how long you're going, and maybe if you're the trip leader or the guide, the host, this has to be done multiple times during a trip, right? Maybe, meaning the wound's just not going to heal overnight. And you're going to be fishing and in salt water on the river in waders. That thing needs to be cleaned and checked, daily. So that's where sort of your bigger kit comes from. You just need a few more supplies to take care of that. So again, if everybody's sort of picturing this, it goes back to everything we talked about the mods, meaning you open an organized kit, and instead of pulling a tourniquet out, you just reach in and grab your wound care stuff to treat a wound, or vice versa. You're not digging through sprains, strains, gloves, wound care to get a tourniquet when things have gone sideways. Oh, all right, hang on. We just got a couple more people can wrap their head around. Blister care. So check this out. When we worked up on Everest at Everest ER at the rescue clinic, the number one showstopper for people summiting Everest were blisters. It was not hypothermia. It was not trauma. It was not alcohol. It was unattended and terrible blister care. And as y'all know, it's a showstopper, right? So have a blister care kit. That's a big one. And commercially, you can get them. They're in their own little pouch. You got the moleskin, these great things called Blistoban. Definitely write that down. These things are amazing. Blistoban, and then good old moleskin and duct tape. So just have a mod for blister care for sure. I need to move y'all again, but I think this says tools. Yeah, tools. Again, we don't have to get deep into that, but the number one thing, period, that needs to be in your kit is, and I'm going to just say the sort of the street name, but trauma shears. And what trauma shears are in the movies, on TV, and in real life, you'll see what like the paramedics, the flight nurses are carrying in their pants. They're the scissors that cut a penny in half. They're lightweight, and 90% of them look just like this thing. And you can get them, and they are this big. And I'm not kidding. It's great. Look at ConterraInc.com. We sell them. They're teeny. My point
Hey,
is,
Mike,
look, say it
I
again.
use I use side cutters. I guess that's the same thing, right? For one-aught
Um,
bass hooks.
yeah, well, will side cutters cut through like a pair of waders and a wading boot?
No, but they'll take a one-aught hook out, snap that thing in half.
All right, cool. Well, I'm cool if you're taking a one-aught hook, but if you got to cut waders and a boot off,
No.
um, check them out. They're literally made for that, right? In the medical world, you come in, they don't unbutton your breeches and your shirt and gently take them off. They cut the shit off of you right then and there. And these trauma shears will literally cut the sides of wading boots in half. And that's huge. I mean, it doesn't sound like a big deal, but if you really think about it, you know, and I'm not getting graphic, but I'm just giving you a mental snapshot of why somebody has a broken ankle with a bone sticking out inside their wader. Man, the last thing you want to be doing is trying to get to that to control bleeding. So trauma shears are, they're awesome. I mean, you can get to it and now you start what you've learned, right? And that's it. I mean, tweezers, sure, right? Tick removal, splinter removal, right? Stuff like that. Tape, good tape. I mean, good tape, like athletic, white athletic tape that football players use. Duct tape used to be the go-to, but man, that stuff's too good, right? I mean, medical tape, that cloth medical tape you can use for bandages, for a sprain when you learn this stuff, right? But duct tape, oof, man, you put that stuff on these days, Gorilla Tape ain't coming off to like change a bandage or something. So good medical tape, good athletic tape is good stuff.
What's bucks? Is that the shape of the head of the tweezer?
Yeah, so they're called Buck's tweezers, and the tip of it is made to go in to extract the tick that is embedded, is to get behind the non-medical term, the pinchers, and remove it. It's great, and it's great for splinters. I mean, it gets in, and as I'm sure there's 3 on here, no, I'm very, especially tonight, I'm very animate about Buck's tweezers.
That's my next question for you, just to kind of throw you off, and I'm sorry, but I mean, obviously you're suffering right now from a tick bite that we haven't really disclosed to everybody, but I saw it looks all red and infected. What happened there? I mean, so you saw the tick, you took the tick out, and did you treat it, or you didn't see the tick?
Never saw the tick at all. Just started having symptoms, and well, because we do what we do, went in and tick-borne, either Rocky Mountain spotted fever or Lyme disease. I got never saw. We're waiting for the antibodies now, and it's amazing. I don't know why, but I'm doing this like nothing. But the signs and symptoms are pretty bad. Never saw the tick. You don't have to see the tick, because think about it. A little deer tick could be down around your sock. You come in at night, kick your shoes off, rip your sock off, tick comes off. You never know. The spot on my leg, which if people are really sick, and I'll show it to you, that is what happens with, you get a bullseye, right? Especially with Rocky Mountain spotted fever. That's it, Chris, you're right. And this came way afterwards. Now, not to waste any time, rewind 5 days before, I was also, look, I'm the worst, man. I had been bitten and had an anaphylactic reaction to fire ants. Look, everything where I live here in Children of the Corn, North Carolina, is trying to kill me since I moved home. But we're not sure. We're not sure if that is an infected fire ant bite or if that is the actual site from the tick. And I will let everybody know, hopefully tomorrow, when my antibody test comes back. Anyway, get a pair of Buck's tweezers so you can pull the tick off. Cool. I noticed there was 0 sympathy from anybody that I have a tick-borne disease, but moving on.
Are you
okay? Oh yeah, I'm doing fine. So let's look at this next med, and we're not going to go down this rabbit hole very much unless I know there's one person on here that will make me go there, but the medication module. This is over the counter, and then I'm going to talk about what to do about prescription meds here in just a bit, I guess. I don't know how long I've got, but just think about the things that you keep in your bathroom closet thing that you treat every day. This is day-to-day stuff, right? You need to take care of pain, Tylenol, ibuprofen. There you go. Benadryl, diphenhydramine for your allergies, your bug bites. It'll do 19 different things. The ins and outs. And what I mean about that is vomiting and diarrhea, right? So again, there is a time and place to treat that. You're just not supposed to stop it at the first incidence of either one, because the body's trying to get rid of it. But there comes a time you need to do it, especially if you're getting on an airplane. I'm just saying. So think about the over-the-counter medications for nausea, vomiting, and diarrhea that you can get, right? And there's a plethora of other things. It's just think about that mod. Here's what I'm going to say about prescription meds, which I can knock it out here. That way we'll save some time when we're talking about like trip prep. Is I don't think you'll go to your I don't know what you call it, your doctor, right? I don't, your PA, your clinic, wherever you go to get health stuff done. If you're going on a trip or an extended sort of local type trip, go to the clinic and just talk to your medical provider and say, look, here's the deal. And again, I'm way ahead of trip preparation, but you just talk to them. Say, listen, I'm going to the Seychelles for 2 weeks. And your doctor may not have a clue where the Seychelles are, but being a medical provider, he will look it up and see, okay, cool. It's in the middle of the Indian Ocean, in the middle of nowhere. Here's what I think you should carry. And he'll recommend the most simple, effective, multiple type, say, antibiotics for a skin infection, for a respiratory infection. He may give you 2 or 3 pain pills in case you do have something bad happen. But that's the way to take care of that, is talk to your doc. And listen, once you get them and you know how to use them, you have a prescription, they now travel with you for the next X amount of years short of you taking them, right?
Yep.
Cool. Holy cow, I thought that was going to be a rabbit hole, but it's not. Moving on. Everybody, any questions coming in, April?
Tina's just said that, oh yeah, one of her friends suffered greatly from a Lyme tick bite. And she's sorry. Oh, Tina, you're such a sweetie pie. She's talking about allergies and carrying an EpiPen for allergies.
Yeah.
Is that something that you have any input on?
Hey, listen, that's a great question. Yeah. But I gotta be careful, especially if we're gonna put this out in the inner world for the naysayers to look at. Absolutely. An EpiPen is a life-saving device. If somebody has an anaphylactic reaction from whether it be food, whether it be from a sting, there's only one thing on planet Earth that can save them in the middle of an island, and that's an EpiPen. The question becomes, will your physician write you a prescription for an EpiPen? But let me tell you this. If you walk into that physician with a certificate from a wilderness first aid course that taught you to use an EpiPen, which 99.9% of all legitimate courses teach you hands-on how to use an EpiPen, and they also give you a I don't know the word I'm thinking of. Something when you go to work at a raft guide or something to show the medical director, to show the program director that, hey, I've had this training and somebody needs to let me do it. So again, EpiPen is great. You need to be trained. I mean, they can be bad if you use them wrongly. But that's just the way to help ensure that maybe you get one. I'm going to say it's a 2 to 5 chance a doctor will arbitrarily write you a prescription for an EpiPen unless you go in backed up with training and you're going on a trip and you're the trip leader and blah, blah, blah.
Why is it that they won't prescribe them? Is it just because it can go wrong?
Absolutely. I mean, it's adrenaline, and there are, even though it's a life-saving device and we train stoner raft guides to use them, there has to be some oversight, right? I mean, if it's given at the wrong time, wrong patient, wrong place, it could be, and there has to be follow-up. You can't just give somebody Epi. Somebody gets Epi there, they need to go. The red button needs to be pushed because they could have a follow-up reaction. That's not the medical term, but and if you don't have 2, or it just, there's a lot surrounding it, but I think they're important devices. I mean, they have them now hanging like in airports. I don't think that's true, but I think they have EpiPens available. I know where they don't have them is on airplanes. I just watched 60 Minutes and they had a big bad thing happen where a lady had allergic reaction and they didn't have an EpiPen.
Tina's saying she carries two at all. My sister-in-law also carries a couple of them. On that note, Tina's asking, do you have any recommendations for GPS location equipment to carry in case of a sting in an area out of cell range?
Holy cow. Everybody's jumping 7 slides ahead. It's coming, Tina. Can she hear me?
Yes.
Oh, it's coming. 2 slides away.
Okay, we'll wait.
Sorry, my technical advisor says that I'm yelling.
No, you're not yelling.
All right, check it out. We're gonna blow off of this, except I'm gonna say one thing. Second and third world travel, right? I do recommend, and you can get them. We'll put the link on the sites for the places that you can get suture kits, syringes, needles. Carry a suture, syringe, needle kit because of second and third world countries. You may end up in a clinic and be absolutely petrified when they open their drawer to give you a shot or to sew something up. And it's worth its weight in gold. You pull out of your kit a full pack and say, sew me up with this, give me the shot, here's a syringe with a needle, and they sell them. I mean, that's what they're for. They're for this exact thing. I guess you could use them. I'm not going to go there. You really shouldn't suture shit in the backcountry, but this is for that purpose. So keep that in mind for the traveling angler that's going to these crazy places. They have this for the clinics they may roll into.
Good point. Really good point.
Get ready, Tina. One more slide.
Oh, she's asking, what about tissue glue?
What about what? Yeah, totally. So here's the thing though. Super glue is bad. I'm going to get some flack on that, but it's acidic. It's great. I use it. I put it in holes in my finger during charter season all the time because it's quick and easy. The medical glue, man, that stuff's expensive. I mean, like absorbently expensive. So here's the alternate. They now have the most amazing, I'm going to use a common term, butterfly. What's the Steri-Strip? It's just a little strip of 3M tape that you can close a wound. And if it gets infected or something goes wrong, you literally just take it off. But if everything's good, stays clean, it heals great. There are tons of wound closure over-the-counter devices now that are great. Again, look at one of these links. They offer them at Rescue Essentials. Anything you need. My Medic has it. It's great. Good question. Tina's full of a lot of great questions.
She's awesome. Yeah.
And I didn't pay her to come on here and ask questions. That's the other thing. I'm going to leave you with this thought before we move on real quick. Is the bigger your kit, the less you know, period. It goes with anything, right? The bigger fanny pack you carry fishing, the less you know. We've already talked about that. All right, here comes. How are we doing on time, April?
I'm good if all of you are good.
Yeah, I guess they could just leave, but let me know. I can't see everybody, so if we end up, I don't care. If we have one person that sticks in, this is worth it. Chris, you look like you're going to hang in the entire time. All right, so listen, common sense kind of stuff, but I'm leading up to the big, whatever it's called. On the water considerations, and I'm speaking more for either your local trips, your raft trips. I'm not talking short trips, but just you're not traveling because that's a whole nother slide. Know where you're going and where you are. I mean, duh, that's common sense. But again, Chad can nod if he turned his camera on. We have been on multiple rescues and calls for people local river had no clue. They didn't know where they were. They didn't know where to take out. They didn't have a clue to tell 911 where they were. So now expound that to a 2-day raft trip. Well, you're screwed. And what I mean by that, though, is.
Hey, Mike, I got a question on that.
Oh, okay.
So, you know the 4 boat ramps on a river. Should you tell EMS where to meet you, or should you wait for them to ask? I'm thinking
Totally.
I'm going to tell them where I'm going.
That's right. In this day and time, if you were, look, I'm going to answer this honestly as I can. If you were to have this happen on Chad and I's shift or on anybody's shift in Colorado where we worked in the Rocky Mountains, we would tell you we would be exactly where you were. Now, anywhere else, I can't speak to that, and I wouldn't let them make the decision unless they tell you, right? My point is this. When you call, you have a plan, which is this next thing coming down. Have a plan. You're like, we're going to the next boat ramp. We're 15 to 20 minutes out. If they come back and say, and I can't see who's talking, who's this?
Joe.
Joe.
Joe. If they say, Joe, we got you, buddy. We see you. We pinged you on the cell phone. We've got a trailhead 1 mile down the river. See you there. Does that make sense?
It does. This is in the
Yep.
Ozarks. It's likely they're going to meet you at a conservation ramp, but
Gotcha.
I'm going to tell them which one I'm going to.
Totally. Yep. I mean, if you have got that plan and you've got it together and it's solid, dictate. Unless emergency services comes back and gives you a definitive reason not to, meaning whether you know it or not, there's a ranger nearby, there's somebody scouting down on the river I mean, you're in the Ozarks, you're like me, you're children of the corn there, but they may know something you don't. But if you have a plan and you tell them that, they're going to appreciate that more than you know, right?
Thanks.
You're welcome.
But so I have a question on that. Can you tell them your GPS coordinates and expect that they're going to be on the next helicopter in, or are you screwed if you're in the middle of that river there in that slide?
Well, it depends, and we'll talk about communication devices here in just a second and how they kind of work. But if you have cell service, they can ping your phone. I mean, the dispatch centers, when it comes in, it picks up your location. You don't even have to tell them, right? I mean, nowadays it comes up on 911 and says, here's where they are, right? And some bring up a map, right? Google Earth, some kind of map. But here's the thing, between this person sitting at a dispatch center that you call 911, I'm speaking solely of 911 or whatever y'all have in Canada. What do y'all have in Canada?
911.
Oh, shit. Okay, cool. They now have to dispatch it to ambulance. They have to dispatch it to a search and rescue. I mean, it goes somewhere, right? And then they start coming up with a plan. But in Joe's case, who either guides or fishes this section, he calls her up and says, look, I got a broken leg. I'm in a boat. I'm on where'd you say? The White River? Where are you? The Ozarks.
Yeah, it could be the Gasconade, the Merrimack, the Current, the Elk. It could be any of them.
Cool. But you tell them that and you say, look, I'm a mile, 2 miles from the boat ramp. I don't think there's any other access. That's where I'm headed unless you tell me otherwise. And then you go. If you're on this river and can't get out because of cell service, I'm going to talk about that in one more slide. Cool. So again, like trip preparation going to Bolivia, the Seychelles, Belize, wherever you're going on a trip up there or down here is no different. We spend hours, days, months, and years looking at Google Earth. We look at what fish are being caught, water levels. Take a minute to kind of wrap your head around access points, right? Take a minute to look where the local clinic is. Cell phone service, there are some apps and stuff out there that let you know if there's service, but they don't work because they said I have it at my house and I don't. So my point about that is just have a plan with where you are and don't make the plan when the shit hits the fan, when it hits the fan. And I know that's kind of weird to say because we're going fishing, but spend some time go down that hole and be like, all right, if something happens, what am I going to do? What's the plan? Right? And I can't answer that question. It's going to come with where you are, your experience. Call people. I mean, I have called, well, and granted, it's a little different because I'm a paramedic and I can lead with that. But I've gone to some places in, say, Montana or somewhere where I've called dispatch, sheriff's department, and said, hey, I'm coming up to fish this remote place. What's my options, right? And they're happy to tell you that, look, there's no cell service. If you've got spot or, what we're getting ready to talk about, we get notified and we know the area well. So you just sort of have a plan, but I'm a geek like that for sure. And then that's the red button plan. What are you going to do if something happens on your trip? Short, long, doesn't matter. Doesn't matter if it's a day trip. If you've got a plan in your head, stress level stays low. You've kind of gone through it, even if it's on the drive there. You've kind of gone through a plan and now you don't think about it again until it happens. And then you've already got a mental snapshot. Cool. I just put leave a plan, and I do that for either if I'm doing charter folks here, like a class for charter captains or whatever. Same with people doing a float plan. I personally, I don't call my wife at work, but I'll leave a note on the counter saying running from Indian Island to the Pamlico Sound. At least she's got a 60-mile radius to tell somebody if I don't come home. I just leave it on the kitchen counter. I could do better, but just keep that in mind. I think it's great. I have seen notes. Chad can quantify this. I've seen notes at our local stream on the Dream Stream. I've seen notes in the canyon that people just put a note under their windshield that says fishing upstream from Cheeseman Canyon. That way, if they don't come out, boom, somebody at least knows they're there.
In New Zealand, there's signs with just an arrow saying that I went this way or I went this way.
I've seen, yeah, perfect. Sweet. All right, everybody good there? Tina, get ready. All right. Again, I'm not going to go deep into the rabbit hole here, but just some considerations. Cell phones are great, but they don't always work. Don't rely on them for sure. But you can now get, these are just some options. I'm going to move y'all over there. This little Zolio thing, it connects your cell phone to a satellite system so you can message. I mean, you can't go on Instagram and post the fish you caught, but you can message out, and it's just another option to get your cell phone to be able to message. Kind of cool. I've been with people that had them, but we've never really used them. But I don't know. They seem to be okay. Tried and true inReach and or Spot, right? That is a satellite messaging device. And it picks up the Iridium satellites as long as you got a clear sight to the sky. You can, depending on the model, use them in one of three ways. You can flip that little button up and hit the red button. And it says bad. It sends it to SARSAT. SARSAT sends it around to Virginia or whatever, depending on where you are. And down here, it goes to Virginia. Virginia locates it, finds out where you're near. They contact emergency services, and they spool things up. They can send you a message, depending on the model. You can't talk to them, but they could send you a message that says, message received, help is on the way, or some shit. So that's a great device, in both inReach and Spot. And depending on what model, there's two-way communication. You can push a button that says, I'm fine, a pre-programmed deal. Everything's cool. You can push it as many times as you want. It's all good. Or you program one in that doesn't go to emergency service. It goes to a contact that says, whatever, shit, and help. And you kind of let it go from there. Let them make the decision what to do. So great devices, 100%. I mean, again, it's Iridium, which is covered all over the planet to include Antarctica. So a good Inmarsat system, or not Inmarsat, I'm sorry, shouldn't have said that, but I'm just going to say satellite, not confuse things. And then the bestest thing in the whole wide world, and you can think about this for longer trips and whatnot, because remember, you can't communicate but with like one and two-way text with inReach and Spot, but a satellite phone that is Iridium, right? mean, there's Tayloe, but I don't know why anybody would have Tayloe. I'm 100% sure Canada is on the Iridium system as well. So it's two-way communication. You pick up a sat phone, you have two options. Push the red button and it goes to SARSAT. SARSAT sends it to emergency services, gets you located, finds out what's going on, or you just dial it. You just have numbers programmed in and you dial somebody up and you're like, I'm in trouble. And you can now talk to these folks, whether it's 911, whether it's rescue services calling you back during the rescue, emergency services can't find you. I think they're amazing. And look, I'm going to tell you, a satellite phone is cheaper than an iPhone, whatever, 500, whatever the latest model is.
Yeah.
Keep this in mind too. You can rent satellite phones, and that's the next, when we get down to trips, think about that. It's great. I mean, even if you want to call home or plug it into your computer and post shit on Instagram, you can rent them by a prepaid deal, put it on a card, take it, come back, send it back to them. You're good to go. Let me finish this and we'll see any questions. And then there's always the personal locator beacon or the emergency position indicator rescue beacon. So the EPIRB or the PLB. This is something that people are starting to carry more and more and more, even though there's inReach and Spot. This is just one-way communication. It is with two different SARSAT systems and satellites. I've got one on my boat. So you flip the antenna up, push the button, game on. There is no oops. It is, you've just alerted the troops. And it GPS location, it beeps, they can hone in. The helicopters can home in when they get close as well. So these are other options, both land and water based.
Excellent. Tina saying thank you. Yeah.
Tina, you good with that?
Yes, thank you for the clarification between the inReach and the satellite phone.
Oh,
I didn't realize that inReach was like only out and that the satellite is both in and out communication. So that's
no, hang on. I can't, I'm actually thrown, I'm taken aback because I hear your voice. No, let me clarify. Both inReach and Spot is two-way communication. You can, depending on the model, you can, you can send messages depending on the model. This little one right over here in the picture, that is just pre-programmed messages or hit the red button, shit has gone sideways. But the other models, you can communicate with inReach and Spot.
Oh, okay. Sorry, I misunderstood that then.
Yep,
okay.
Text.
Okay. Okay, so there's still the ability to communicate in and out on inReach.
Okay. Yep, same. But then also with the upper models of inReach, you can tether it to your phone, like the Zoleo or whatever that thing's called down there.
Okay.
It is the Zoleo.
I'm in an area where I'm like in and out of satellite coverage all the time. So I need something that I'm not relying on my phone.
Yeah.
Just to know that safety wise, I can reach out for help in some way.
You're out of cellular range, not satellite, correct?
Yes.
Yeah, totally. And again, these do have their limitations, meaning you've got to have a clear view of the sky. Like you can't be down in a canyon, jacked all up underneath a cave. You've got to crawl out with a broken leg to where you can see the sky and get it to hit a satellite, right?
Okay. Yeah. Usually I'm in an area that I can.
Sweet. And look, you've just like medicine, just like first aid, just like a first aid kit, you've got to practice with these before stuff goes sideways.
Yeah.
100%.
That's good advice too. Thank you.
That came from my technical advisor sitting across here.
Well, thank you, technical advisor.
I'm getting little sticky notes. Cool.
Tina, I've always used Iridium products. I think where you're based, because you're talking about the cabin, right?
Yes. Yes, I am.
Pretty open up there. I think you'd be all right with the Iridium services, but I've got a bunch of friends in Alaska who swear by inReach too. So just do a little Googling and see what works best for you, I think.
Yeah. Okay. Yeah. Maybe we can chat about that one day.
Yeah, and then
Where
let me know what you end up with so I can get the same thing.
for sure.
Okay.
Okay. Thank you.
Are y'all done with your little conversation?
Yes, thank you very much, Tayloe.
That was funny. Hey, April, where's this? You stood there.
Well, it looks like Seychelles to me.
Let's keep it in our hemisphere.
Well, you've got a mothership somewhere. I don't know. Where is
Abaco. Yeah, you can't see the picture over here. So that is Abaco.
Oh, okay. How have I done Abaco? I don't think I've done Abaco.
No, Bears?
Mm-mm.
Oh,
Oh, wait, which one was owned by anyway?
Bears is the pink. Yeah, is the pink one. Anyway, sorry, it's getting late. All right, here we go. That we're
Maybe
coming.
Falls was Abaco. Which one was Oliver's?
Well, none now.
Right. I did do Abaco, I think, when we were filming Buccaneers and Bones once.
That was it. So Abaco was Buccaneers and Bones, and then Bears was his other one in oh gosh, whatever. I've got tick-borne disease. I shouldn't remember.
I'm throwing you off. You do you.
All right, cool. So travel considerations. Again, most of this is common sense. Roll your eyes. I'm cool with that because that means you already know. If one of these, boom. Do your homework. And I'm going to tell you for what we do at Fins West, where we go to lodges, do a course for the guides and staff. We do an emergency action plan for the operation and so forth. When I do this talk, I usually get some feedback from lodges. Some we haven't done, some are mad. If you've got a question about, and when I say medical capability, look, I don't mean a CAT scan in Brazil. But if you want to know how you're going to get out, how you're going to get your dad out if something happens, what's the plan? That is a legitimate question for either the lodge themselves, if you're booking direct, or the guide service or the outfitter, or the actual like Yellow Dog. When you're dealing with Jim or somebody at Yellow Dog, and they do an outstanding job of answering this question because we work with them. But my point is, ask the questions. And again, the questions usually don't get asked because it wasn't until we started doing this 10, 11 years ago that we started getting, emails from random lodges going, they heard from y'all to call us and ask us, and I'm not talking about is their guides trained. I mean, you can ask them that, but it's more the questions that you legitimately have. Not do they have wilderness first aid, or they trained, whatever. But it's like, look, if my dad has a heart attack, if I break my leg, what's the plan so I can prepare? And I have a plan. I'm not going to rely on those people, right? Ask those questions. They're tough, but again, we spend, holy cow, years, months, weeks, days and days looking at the water, what lines to use, what fish are there, blah, blah, blah. Spend 20 minutes on, is there a clinic on the island? Is there a clinic down the road? Can I just roll in and, get this cough checked out if I'm there? So just stuff we don't really think about getting ready to go on a big trip. And the longer and further away, the more time you need to spend on those questions. So listen, if you're not booking, look, Andrew, nice screenshot there of a rock. If you are going on a do-it-yourself, or going somewhere and you're getting a guide after the fact, here's some resources. The CDC, again, I don't know what the comparable thing is up in Canada. But the North American, or our CDC, is a great wealth of information. Love them or hate them, I don't care. But you can go there and dial in where you're going specifically. And it lists vaccines you need. It lists where the clinics are, where the hospital is, what the risk assessment is. It is just a wealth of information. State Department in the United States, you can get that as well. But again, the CDC has links where you just go to the Center for Disease Control and boom, you can just click along and locate where you're going, and it answers medical questions that maybe you can't get because you're not booking through an outfitter or a booking agent, right? Great resource for sure. We've already talked about talking to your doc, especially if you're going on a long duration or far away trip. Pop in, let them know, or whoever, your medical provider, wherever. And then another amazing resource, usually big cities, not small at all, is a travel clinic. We go to them a bunch, and they absolutely dial you in on all that, right? I don't know about like where clinics and stuff are, but as far as what meds you need, what vaccines you should have, what's going on in that particular area, a travel clinic is a great resource, but unfortunately, you've got to go to some crazy concrete jungle city to get to one, I would think. Have a plan. It seems like a cop out, but it just is what it is. Have a plan on the medical side, right? Just know ahead of time. Have a mental snapshot of, because it's not going to go like your plan ever. But if you start from scratch, when again the proverbial shit hits the fan, that plan unravels quickly. But if you have something to go off of, you can pivot when you hit a roadblock. So just have a plan. We talked about communication devices, right? So especially long duration trips, middle of nowhere, even though, man, we've been deep lately and my cell phone works. It doesn't work at my house on coastal North Carolina, but it works in the middle of the jungle in Honduras. I don't understand it. And then full disclosure, we are partners with Global Rescue. We work with them, have forever, but there's a reason. They are the best, period. If you don't know what Global Rescue is, it is a membership service. It is not an insurance policy. It's a membership service that provides all sorts of great things. But the biggest is medevac, assurance of medevac. So anywhere on planet Earth, if you have a membership and a sat phone or some way to call them, something goes down, you call them and they get you out. Now, I'm not saying they land a B-3 helicopter with a bunch of paramedics in the back. It may be a donkey with some dude with no teeth, but that one means it's your only option. That wasn't an option before. Somebody will show up from a helicopter with paramedics to a donkey with a dude with no teeth and get you somewhere to definitive care. The other super cool thing about GR is you can call them and say, hey, I stepped on some coral 2 days ago. I don't think I can send you a picture, but let me describe it to you. And boom, Johns Hopkins University physician talks you through it. Ask you questions. Here's what you need to do. And if you did the right thing and you have the right antibiotics, they say, take this, call me tomorrow. It's great. And number 3, they do provide security services, but I'm not going into that because they do pull people out of when things go sideways. But their app, when you're a member, all this homework that I have suggested you do, you just click on the app and you go Belize, Honduras, the most remote places on earth. You click on that area and it tells you everything: security, hospitals, clinics, vaccines, threat levels. It's, now granted, obviously I have it and get it, but I wouldn't go 100 miles from my house without GR in this day and time. And I get no kickback, by the way, 0. They've tried to, but no. So I can tell y'all honestly, look into Global Rescue. I wouldn't go anywhere without the thing. And it's cheap. I mean, when I say cheap, I think when you go look at it, it'll blow your mind what a 7-day, 14-day, or a year policy or membership is. Consider it.
We don't take a trip without it.
Yeah. Cool. Sweet. That's getting ready to happen here in a month. All right, guys and gals. Well, I'm in North Carolina. Guys means gals too. So here's the quick review. Take a course. Period. I put it on your list. I mean, summer's here. Do it. Even if it's a 1-day quickie, do something so you'll have a mental snapshot when things go wrong. Get an appropriate first aid kit. Know how to use it. Make sure it's bomb proof, has the right stuff, and it's organized. Have a plan. We've talked about that for sure. Comms, make sure you have reliable communications, especially the further you're away from definitive care. Do your homework for travel, like we talked about. Get a GR policy when you travel, and just don't lie about fishing.
That is fantastic, Tayloe. I've never taken so many screenshots before on a presentation, so thank you for that. And made notes, so you know it's good. This is great. Who has got questions?
Hey. Oh, you can go, Andrew. Oh, wait.
Okay, thanks. Hey, Tayloe, what is a good, or let me ask you this, man. When you get somebody on your boat to take fishing, when you're guiding, what do you do you have a little brief you give before you go out and say, hey, man, here's the first aid kit. If I stroke out, do this or don't do that. Yeah,
I got you.
Yeah.
Yeah, man. Yeah. Andrew Asher, Shearwater Flats Fishing, Florida. Great question, dude. Absolutely. And I don't know how many outfitters or guides we have on here, right? But it sounds like people do go with groups and stuff. Yeah, absolutely. Every time. And it's done twice in the United States, I think. But yeah, totally. I'd go through exactly what you said. Other than the Coast Guard mess, here's the life jacket. Right. I show them where the first aid kit is. I show them the red button on the VHF radio, which has got the AIS system that if I go down, just push it. I show them how to talk on the radio. And I mean, not, you know what I mean? I just show them how to push the mic, right?
Right.
And I show them on my chart plotter and GPS. I leave the coordinates on every screen, whether it's my chart plotter or the fish finder or whatever. I leave the coordinates in the corner and I show them. That way, if they get asked, and I show them where the EPIRB is and how to push it.
Okay, that's great. Yeah, thanks.
Yeah, man. Good question. Right. And everybody should do that on every group if you're responsible or you're the guide. And it doesn't get done as much as it should. I'm talking about even in a drift boat, right? Doing a river trip. Good question. Heck yeah, man. Do a plan.
Kent, did you have a question?
Yes. I was just wondering about those trauma shears, and you sell them on your website?
No, I don't sell anything but information, brother. No, we'll do Conterra. So the Conterra, the little one. So look, I'm gonna get April. I think you're gonna do it anyway, to post up Rescue Essentials. And again, if I spell it out, I can't remember if there's a hyphen in there. But that's a great place. But are you in Canada or are you down here?
I'm in Canada.
Yeah, dude, I'm not kidding you. And I hate to say this, but you should go to Rescue Essentials. Conterra, we'll put that site. That's the company I do work for, where we sell kits and some emergency stuff. We got the little ones and the big ones. But if you truly just Google, I hate it, use Googly and put in trauma shears. But even though they're good, there are some cheaply made ones. They'll still cut a boot, but maybe they'll break after that. But yeah, I would say Conterra or Rescue Essentials, and we'll throw the link in something.
Perfect. No, that's awesome. I also want to see what else was on the Conterra website. What else is there for an emergency kit or whatnot? So.
Yeah, totally. So again, and I'm not throwing Conterra under the bus because I work for them and I design their kits and it's all good. I love them, but we only have 2 kits because we don't make kits. We made them because I work for them. We make more like mountain rescue, heli bags, stuff like that. But we do have supplies. Rescue Essentials, man, it's going to blow your world when you go on this site. You're going to have a kit the size of a Mack truck by the time you're done on that site.
Awesome. I'm making notes right now of what to link up as well. And
I need to look, and I'm sorry, guys, I'm the worst. Conterra is not even Conterra.com. It's like
no, it's Conterra-inc.com, and that's CONTERRA-inc.com, and I will definitely link all this up.
Yeah. Okay. Cool. Sweet.
Some cool stuff on it. All right. Any other questions before we let Tayloe go be sick again? And just so you all know, he drove. How far did you drive to get stable internet?
7 hours.
7?
Yeah, I did. It's not bad. I drove an hour and 30 minutes to one of my best friend's house. Cabin. We're in. Check it. Good surrounding cabin. But yeah, I needed somewhere comfortable that had great internet and technical support. So yeah, but I'm staying here. I'm not driving home.
Good, good. And you get the results of your wound tomorrow?
I hope. They said 48 from Saturday, so we'll see. And I didn't get it today.
Okay. Well, we look forward to hearing what it was. Al, I think Al, you're still on there. Thank you for your help with all that. And if people have questions, again, Mike, can they reach you directly?
Yeah, absolutely. Hit me up. I'm happy to do it. Well, shit, if I say this, it's going to go on YouTube and now it's going to be insane. But yeah, Fins West, FINNSWEST@gmail.com.
Yeah, don't post these very often on YouTube because I keep them behind the members dashboard. But because this is a first aid, not a first aid thing, but because it's information I'd like everyone to get their hands on. So it will go public. So please only reach out to Tayloe if you have a serious question or are
No,
lost
yeah.
one. Look you.
Happy to answer any questions. I mean, because this is good stuff, right? I mean, it's not a fishing technique. It's something everybody should be dialed in because it could be me. That's the biggest thing. I could be in your area and you should know what to do if I go down because obviously I have issues.
Right. With bugs, you mean? But
with
even,
everything.
I'm feeling guilty as a mom. We were just in New Zealand the other day, and you're walking through the fields, and there's these hidden fence poles. All it takes is to stumble over a tuft of grass and go right through one of those fence posts. I mean, I, as a responsible parent, should know how to do these things. I absolutely have to take a course. And you know what? I am officially a Girl Guide leader now for Girl Guides down here, and they make us take it anyway. So I'm doing my regular first aid. I will add on my wilderness first aid because of you. So thank you.
How do you know? Oh,
what's that?
Well, Al just said Tina's a part of that group too. He presumed, and I asked him how he knew, and said because Tina was dancing when you were saying that.
I think Tina was also did Girl Guides. Yeah, there's a lot of great things come from the whole Girl Guides, Boy Scouts, Girl Scouts thing. But another conversation for another day. I'll let you have a night. It was great to see all of you again this evening. Thank you for attending. And Tayloe, thank you so much. I hope that you feel better soon.
Thank you.
Okay, talk to you soon.
See you guys. Be safe.
Thanks. Bye.